Okay, class, this is Mrs. Holmes again. This is Unit 14, Chapter 27 in your textbook, and your last lesson for this class. Palliative care is a type of care given to people who have serious chronic diseases such as cancer, AIDS, and congestive heart failure, as well as to people who are dying. So it's just comfort measures, there's no cure. The goals of palliative care include controlling the symptoms, reducing suffering, prevent side effects, maintain quality of life, and emphasize a holistic approach. Remember, palliative care works to manage symptoms. It is comfort measures. They're not trying to cure the disease. Terminal illness is a disease or condition that will eventually cause death. Hospice care is often the next step when you're diagnosed with a terminal illness. Hospice care, the goals of hospice care include, one of the requirements is that it must be ordered by a physician. Usually the physician feels like the person has 6 months or less to live. It can be given in a hospital, it can be given in the nursing home, or it can be given in the home. That uses a holistic approach, and it focuses on the resident and the family as a unit. It is compassionate care, comfort care rather than cure again, pain and symptom management, assistance for psychosocial needs. It helps family obtain financial counseling and legal assistance as well. Why is it important that residents who are dying have control over their lives as long as they are able? That's just a question for you to ponder. Grief, a deeply emotional process that is a response to a loss. Grief includes physical, psychological, emotional, social, and spiritual reactions to a loss. The 5 stages of grief, this comes from Elizabeth Kubler-Ross. She's the author of On Death and Dying. Denial, an example would be refusal to believe that they are dying. Anger is kind of a why me. Bargaining is yes, me, but maybe you could let me live long enough to see my daughter get married or something, that kind of a bargaining type thing. Depression is a need to mourn and review their lives, and acceptance is preparing for death. 5 stages of grief. Remember, not every resident goes through all these stages or goes through them in this exact order. The legal rights for people who are dying, they have the right to have visitors. So even right now with the COVID, that's the exception. If somebody is dying, they will let the family in. It may be inconvenient to have visitors coming and going at odd hours, but when death is close, it is an emotional time for all those involved. The right to privacy. Privacy is a basic right, but why may privacy for visiting be even more important now? The right to be free of pain. It is very important to monitor dying residents for signs that they are in pain. If they can no longer speak, how else can you tell if a resident may be in pain? Some of those symptoms would be their blood pressure will be higher, and their heart rate might be up. They may be grimacing, things like that. The right to honest and accurate information. Residents have the right to honest information about what is happening and what their diagnosis is. Refer medical questions that are outside your scope of practice to the nurse. The right to refuse treatment. Have you ever cared for someone who did not want more treatment? How do you feel about that? Whether you agree or disagree with a decision, the choice is not ours, but belongs to the person involved. For example, a lot of that comes up with the people of Jehovah's Witness. Their religion doesn't allow them to accept a blood transfusion, and that may be the one thing that could save them. So that's difficult sometimes for the nurse, but you have to respect their wishes on that. The room environment. For the care of the dying, you need adequate ventilation of the room. Photos, religious item cards within reach. Fresh flowers may bother the resident. Remove if necessary. Sometimes the smells. Do not wear perfume, cologne, or aftershave. The care of the dying. Skin, nose, and mouth care. You're going to give frequent skin care. Bathe often, change the gown and sheets often because a lot of times they are kind of diaphoretic and they need their gowns maybe soaked. So pay attention to that. Give incontinence care promptly. Turn and reposition often, which would be every 2 hours at least. Give oral care frequently. A lot of times they are mouth breathing. These are the ones that need their mouth swabbed every couple hours. Offer ice chips, lubricants for the nose and the mouth. Breathing problems, report gurgling or rattling. Cheyne-Stokes, alternating slow, irregular breaths followed by rapid. So you might think that all of a sudden they quit breathing and then they start breathing really fast. That's what Cheyne-Stokes are. And the nurse can give meds to help dry secretions if they're doing a lot of gurgling. There's a patch, a scopolamine patch, that's common ordered for hospice patients. It helps kind of dry up those secretions. You want the head of the bed elevated, and oxygen and humidifier may be used. Those are often more times for a dying patient. That's considered comfort rather than cure with oxygen. They're able to eat. You need to feed them slowly. Encourage fluids. Do not force residents to eat or drink. Report nausea, vomiting, and diarrhea. Elevate the head of the bed. Pain control and comfort. Pain control and comfort relief is critical. Observe and report signs of pain. They may be connected to a PCA pump that they control, which is you give them a button and they push the button when they want a pain medicine. It's hooked up through their IV, or just blankets for temperature changes. And they may vary between being hot and cold. Diminished senses, you want to keep the room softly lit without glare, but you don't want it dark. You don't want all the lights on either. Use alternate forms of communication, boards, pictures, and hand gestures. Speak normal tone of voice and describe care that is being performed, but do not expect an answer. The sense of hearing is the last sense to leave. You need to remember that always. Even if you're not sure if they can hear you, you still need to communicate with them. Factors that influence feelings and attitudes about death. Previous experiences with death. If somebody, their only experience with death was a real traumatic situation, like a car accident or a family member got killed, their response to death is going to be different than other people's. So you have to keep that in mind. If you think somebody's overly responding, it has to probably do with their past experiences with death. Personality type, religious beliefs, cultural background, honor that whenever possible. Customs may include burying personal items with the body, or some bury in a coffin and some prefer cremation. Factors that influence feelings and attitudes about death. Attitudes about death change over the adulthood, and what that means is you don't think the same way about death when you're young and raising children than you do when you're 80 or 90 and feeling like you're kind of ready to meet your maker. So they do change over time. You know, when you are young, you're worried about who's going to take care of your family and that kind of thing. And when you're older, it's just, it changes. What is the number one fear older people express about dying? Anybody have a guess? And it is, everyone fears dying alone. A lot of elderly people do outlive all their family, all their friends, and it's scary to think you're going to die all alone. Signs of approaching death: cyanotic, pale, darkened mucous membranes, cold skin that looks bruised or mottled, which is called mottling, heavy perspiration, fever, low blood pressure, increased pulse, Cheyne-Stokes breathing, gurgling, rattling sounds when breathing, difficulty swallowing, decreased appetite and sense of thirst, dry mouth, nausea, vomiting, diarrhea, extreme weakness, and exhaustion. Decreased sense of touch, loss of feeling, beginning in the legs and feet, loss of muscle tone. Fallen jaw is the telltale sign where their mouth just kind of hangs open and doesn't go closed. That's definitely a sign of impending death. Inability to speak, dilated pupils and staring eyes, So if you go in there and they're still breathing, but they've got the fallen jaw and their pupils are dilated and they're just staring off, then it's not going to be very long. Loss of vision, urinary and fecal incontinence. Decreased urinary output. If they have a catheter, you'll see that there's very minimal in their catheter, and that it's probably very dark. Hallucinations, extreme drowsiness, disorientation or confusion, and last to leave, of course, is hearing. As death nears, sensation of pain may decrease. Okay, so those were signs of approaching or impending death. These are the signs to check. This is a sign of death. Okay, obviously, there will be no pulse, no respiration, no blood pressure. The jaw drops, eyelids are partially open. They'll be in a fixed stare. Urinary and fecal incontinence is not uncommon after death, and their pupils will be dilated, and the nurse or the doctor can confirm the death. Body after death. Rigor mortis is the stiffness that occurs after death due to a biochemical change that causes the muscles to become rigid. Helping family deal with death. Allow family to show their feelings, listen, let them talk. Let them know their family member was valued by staff. Avoid cliches like this will pass and it is for the best. Honor the request for spiritual leader or clergy person if they ask. Families may wish to stay with the body for a while and some may not. Allow them time to do so. For postmortem care, you need to position, this is a CNA job, guys, just so you know. Position the body in good alignment on the back with the legs straight and fold arms across the chest. You're going to put a clean gown on them. You're going to clean them off. The nurse should take any tubes out. You're going to take off the oxygen where they're just laying like they would be laying in their coffin. Rigor mortis usually begins 2 to 4 hours after death, so it's important to get them cleaned up and in that position. Otherwise, the funeral home, if they're going to have an open casket, it's going to have a really hard time getting into a position to be presented for the family. Postmortem care, you need 2 pairs of gloves, drainage pads, sheets, a clean gown, washcloths, wash basin. So this is all, you're going to clean them up and put a clean gown on them, basically, and all the tubes will be removed, like I said. You'll turn off the oxygen suction equipment, gently close their eyes, close their mouth. Sometimes you have to put like a rolled cloth underneath their chin to keep the mouth closed. You're going to gently bathe them, gently brush or comb their hair, cover body with a sheet just to over the shoulders, do not cover the face. Put on a clean gown, position body in proper alignment, arms across abdomen. Okay, so this is a CNA's job right here. So remember what they tell you, they need you to do postmortem care, that's what you're doing. Closing the mouth, closing the eyes, putting them in position, cleaning the gown, and a bath. Advanced directives, legal documents that allow people to decide what kind of medical care they wish to have in the event that they are unable to make those decisions for themselves. The page, I think I'm going to stop there.